And so once again, we have Ms. Sylvia Lemus from Sonoma County, who comes over and updates us every week about what is going on with COVID, the vaccine, the testing that is going on, the metrics, which are essential in regards to reopening Sonoma County. Welcome once again to the show.
Thank you, Rafael. So today I want to share with you some of the data and the metrics for this week. So we have now a total of 29,255 cases confirmed. In the last 24 hours, at 20 additional. So it is a lot less, but there's still transmission happening in the community. But 20 cases in the last 24 hours is pretty good. We have lost a total of 308 people to COVID since the pandemic began. And it's bad that we've lost 308, but it's good that in the last 2 weeks, we have not had any additional deaths. So that's a good sign. We also continue with testing. We've completed a total of 599,670 tests in the county. In the last 24 hours, we completed around 1,600 tests in the last 24 hours. And the vaccines, we've completed a total of about 295,693 doses of vaccines. And that includes first and second doses, but that's the total of vaccines. Now, for the metrics, we are in the red tier, according to the Blueprint for a Safer Economy, which is a state guidelines that set the levels for all the counties here in California. So we left the purple March 14th and went to the red. Remember that? So our total a rate of new daily cases per 100,000 population is now at 3.6, which is very low, and it must be under 4 to move to the orange tier, which is a less restrictive tier. And our testing positivity rate is now at 1.6%, which is also very good. It has to be less than 2% for us to move into the orange tier. Our equity metric testing positivity rate, though, is at 2.3%. In the orange tier, it's required to be under 2%. So we still have a little work, but the other two metrics already qualifies to move into the orange. So remember, there was two options: either we reach it by metrics and data, or if the governor had said that once we vaccinate 4 million people in the impacted zip codes in the state, and then they would readjust the tiers, and it would be easier for it to move into the orange. So right now we're looking at possibly moving into the orange tier next week, maybe as early as Tuesday. So that's something that is good and bad. Good because a lot of operations, will open up more, but bad because I think people get more relaxed, and there's still a chance of us having more surges, and so we have to be very careful.
Definitely, there have been, obviously, Dr. Fauci and many other experts are talking about a third wave that is happening throughout the United States, and we definitely do not want to fall within that group of people who gets affected. And so it's important for people to, again, be reminded, if you're going to a restaurant and they offer you the opportunity to eat outside, please eat outside. And it's wonderful when I drive throughout Santa Rosa and Sonoma County from time to time to see that some people are actually being very cautious. And even though the opportunity for them to eat inside is there, they choose not to eat inside, but they choose to eat outside and keep their distance still. And that's how it really should be with our community. So I'm grateful to see that some community members are getting the message. What's going on with testing? Are we getting good numbers? Are we still needing to promote more and more testing every day?
We still need to promote more testing, Rafael, because we need to continue with the testing so we can try to identify where we have transmission, because there's still community transmission happening. We know there's gatherings are happening, so transmission is still happening. And so we need to do it to help stop transmission of COVID, and also to help our metrics, because testing also helps our metrics. So what we advise is if for people to test at least once a month, but if they have a lot of contact with the public, if they have a job or something where they're in contact with the public, twice a month, every 2 weeks, go and get a test just to make sure. It's good for your own safety, and it's good for the community to keep everyone safe. And here at the county, Rafael, we have so many options throughout the county. I think around more than 26 options every day of the week throughout the whole county, including Fridays. We have in the morning at Bayer Farm, at Anti-Locust Unity Park in the morning, and then in the afternoon at Bayer Farm. But people can go online to socoemergency.org, and there's a Get Tested link there where they can go on, and there's calendars with links to sign up for an appointment. But the appointments are really easy now. You can get them from one day to the next now, if not same day. You can also call 565-4667 for information about the testing. But the testing is free. It's available to everyone. It's confidential. It doesn't matter what your immigration status is. You may be asked to show an ID, but it's not required. And then you'll get your results in about 24 to 48 hours. So we are encouraging testing for everybody.
Definitely. And with that, we move over to the conversation about vaccines. You mentioned the number of vaccines that have been applied. That obviously is a total. We do have Johnson and Johnson that only requires one dose, but most of the other ones, Pfizer and Moderna, require 2 doses. Can you give us a breakdown of the population? Who in our population has already been vaccinated in regards to the percentage of the population in general, and then the Latinx versus the white community?
Sure. So we have completed a total of 295,693 doses, and that's first and second doses here in the community. And that accounts for, anyone 16 and older is eligible, depending on the job category and their eligibility. But that accounts for 27% of our 16-year and older population has been fully vaccinated, and 53% has received at least one dose of the vaccine. So we're moving towards the vaccination tiers and levels, but not as fast as we want to. And especially because there's changes, and I forgot to mention this earlier, that as of today, 50 years and over is now eligible. And then the 16 years and older will be eligible. So we have so many categories of people that are eligible to receive it, but we're still not receiving enough doses of vaccine. It's still flat. We're still receiving maybe like 8,000 doses of vaccine a week. But we have written a letter to the state officials to request more doses, because we've noticed in the data that other counties around us are receiving a lot more doses per capita population than we are here in Sonoma County, and we are not sure why. So we are writing a letter to request that we get more doses here, because we have large population that still need to be vaccinated. And also about the numbers, just to kind of share a little data. Of the population, our white population is 61% of Sonoma County, and 63% of the population has been vaccinated, of the white community. And our Latinx community makes up 27% of the population, and 19% have been vaccinated. So there's a big difference in those numbers. And I know there's a lot of factors and a lot of questions, and a lot of articles about why that is, and I think there's a few factors, but the county is doing everything that we can to set up special clinics and working with our clinics to apply equity in the vaccine, and we continue to do that. Some of the factors that I think could be that in the beginning we were vaccinating healthcare hospital staff, people that live in long-term living facilities. So it could be that a lot of the people in there had different demographics, and that could be why there's such a big demographic change. And then when essential workers and other, Latinx community started becoming more eligible, then we had like a flattening of the vaccine, and so we've had a hard time making up our percentage numbers. So we hope that in the next 2 weeks that we start getting increased doses of vaccine here in Sonoma County, so we can get caught up and bring some of those numbers more in tune where they should be.
Definitely. And so it's important for people to, again, understand their opportunity will show up. Can you clarify something here that you mentioned, 16 and older, depending on where they work, perhaps if they work at a clinic, or maybe they work at a restaurant, they can get vaccinated now?
Yeah, 16, if they qualify because of their work, they can qualify for at least one of the vaccines. I believe it's let me let you know which one. The Pfizer is for 16 years and older. The Moderna and the Johnson & Johnson is 18 years and older, but the Pfizer, you can be 16 years old and get that one. And you can qualify as a person that works in a restaurant or in one of those qualifying categories. But also if a 16-year-old has a comorbidity, then people with comorbidities and different kind of medical conditions were also eligible starting last week. So like I said, starting today, 50 years and older are now eligible. And then starting the 15th of April, everyone 16 years and older will be eligible. So it's great that they're making more people eligible, but the difficult thing we're having here in Sonoma County is the lack of vaccines to be able to meet our numbers and our requests.
Definitely. And part of the reason why I ask is because, we've had some younger volunteers who have been distributing masks, which again, we're going to be doing this Saturday over there in the South Park area at the Martin Luther King Jr. Park from 10 a.m. until 2 p.m. on Saturday. It's a collaboration between Lideres del Futuro, Humanidad, Mecha RJC, and the Hispanic Chamber of Commerce. And one of our volunteers got vaccinated with the first vaccine, but then they said, we made a mistake. you shouldn't have been vaccinated. She's 17, and then they didn't give her the second vaccine. Should we reach out again to someone who's in charge over there to find out if she should get the second vaccine now?
Sure. Yeah, I would say reach out to them or reach out to my office and we can try to connect you with someone.
Okay.
But yeah, I think that person, if she qualified as a promotora, kind of like a health worker,
Yeah, she is. Yeah.
even if she's 17, that she would qualify.
Okay. So then there has been an understanding there. Okay. Is there anything else you would like to share with us?
I think additionally is just to remember that SoCoEmergency.org has a lot of information and resources about testing and the vaccine and even resources. I know that there is coming up, I don't have any information yet on it, but it's going to be a California rent relief program for renters that is coming up. I know there's information on that. And in April, I think that program takes effect. So we'll be having some more information on that. There will be like a press release, but SoCoEmergency.org has a lot of information on not just vaccines and testing, but also resources for the community. And also there's 211. And then just a last reminder to continue to stay safe and use your face mask and social distance, even if we go into the orange tier, because it's so easy for us to be so relaxed that we forget to be safe. And we don't want to go back into the red or the purple, so we want to continue to stay open, but safely.
Definitely. And since we have a couple of minutes here, I'm not sure if you could tell us, once we go from red to orange, what additional businesses will be able to open, if any?
I think that in orange, I'm pretty sure it's like bars and other places that don't serve food that they can start opening up indoors, and I think to a certain percentage.
Theaters, maybe?
Excuse me?
Theaters, maybe?
Yeah, theaters were already open under the red tier at 25% capacity. It could be that they increased to 50%. I'll have to look and see what the data says for that. But it could be the increased capacity, but theaters opened already with this last going into the red tier. But yeah, so there will be more openings, but we still need to be careful at the same time.
Definitely. Perhaps you could give us a list of the new openings once we go into the orange tier. Next time you give us an update, that way our community will be aware of what they should be looking forward to as they take care of themselves, they test themselves, they get tested, that is, and then they get vaccinated when their opportunity shows up.
Yes, I will do that.
I appreciate that. Thank you, as always, Ms. Sylvia Lemus, for taking the time and being with us. Thank you. Take care.
Okay, bye-bye.
Bye-bye.